We've heard already a lot this morning about what exercise can do for people who've got cancer, people who don't want to get cancer, people who've had cancer. And Barbara is one of the people who actually specialises in this field. She's a yoga therapist and she's trained specially to work with people with cancer. So over to you, Barbara.
Thank you very much. Well, thank you very much for having me. It's a very important conference and I hope I have a very small part to play in it. I'm a yoga teacher, but I'm also a particle physicist, so I've got a bit of a dual personality. I work on food safety and my background is really a scientific one. I've been practicing yoga for 20 years, teaching for 12. I specialised in yoga for cancer patients through very inspiring teachers and very inspiring students that I've been working with. But ultimately, as a scientist, I always have this question at the back of my mind, how does it work? Why does it work? And that's what I'm going to try and cover in the presentation today. That picture is the picture of my yoga room, which is a corridor that is screened off once a week at the Teenage Cancer Trust at University College Hospital, London. And I think it's brilliant. I don't know if you can see it, but we've got these gnomes that are stools on the side of the chairs that are our helpers to get up and down from the mat onto the chair and standing. And this is a great opportunity that I got through the Teenage Cancer Trust to work with teenagers that are undergoing chemotherapy and radiotherapy and their parents or carers. And the class is offered to anybody who is actually on the drip or waiting for treatment. And it's 45 minutes to an hour of respite to try and focus the mind on something different, although the environment is a hospital environment. What is yoga? Can I just have a show of hands of how many of you have practiced yoga either once or regularly? So fantastic, I don't need to spend much time on this. The only thing I want to say is that yoga is this union, this bringing the body and the mind together. And as Sue very inspiringly said, it's about this combination that makes your life meaningful and full of harmony and balance. First thing that you're asked if you're a yoga teacher is, can you stand on your head? And that doesn't really matter if you do or if you don't, because yoga is a philosophy of life. It's a lot more than the poses. And the other aspect of yoga is obviously all the celebrity status, and we all know that Madonna did it, and she got incredible biceps, and it's become more of a fitness component rather than what it is in reality. But if the fitness brings people in, and if people start exploring their mind through their body, that is something that we have achieved. So yoga can be on the curriculum in some countries, in some of the Indian states, and I'm doing quite a lot of work on yoga for people with limited mobility and with the aging population. And the general principles are the 8 limbs, and they are around a code of living, a little bit like the 10 Commandments. But in the Western world, it really starts with the asanas, the body postures and sequences. And pranayama is luckily a word that is becoming more and more common. It's these breathing techniques and breathing exercises. And then there are 3 aspects, pratyahara, dharana and dhyana. They're all around mindfulness. There's a lot in yoga that is about looking at the inner self, finding concentration, finding focus. And that is conducive to ultimately samadhi, which is the connection with the original silence or with the God that you believe in. And it's a journey, and you can pick and choose at the beginning of the journey which elements are going to be for you. But ultimately, it comes all together because yoga is union of a lot of different aspects. Different types of Hatha yoga, and the yoga that are specialized in for cancer patients is Hatha yoga. It starts with the external, with the physical focus, and then it brings in elements of mindfulness, meditation, visualization, chanting. But we live in the Western world, and as I said, as a scientist, that's the way I approached it, and it's most importantly the way a lot of the people that I work with approach it. And this is another image that is linked with yoga in the Western world. The young, beautiful, usually white and usually middle class people who have access to yoga classes. And looking at the research on yoga and its benefits, there are some pieces of research that say the benefits of yoga that are starting to get proven more and more strongly tend to be open only to this type of people who have this idea that yoga is something that is for them. So how do we develop yoga into something that other groups in the population that could greatly benefit from it can feel that is accessible and is for them too? So it's something that we need to consider. What are the studies and evidence? This is going to be the bulk of my talk. And I looked at a number of studies. There are hundreds of clinical studies, and there are tens of systematic reviews. And the systematic reviews have been published up to November 2013, and there are some really encouraging results. So there is moderate to good evidence. This is a 2012 Support Care Cancer published systematic review of hundreds of studies, but only about 13 to 18 could be taken into consideration. And why? Because the quality of the studies that have been done to date on yoga are not good enough to draw firm conclusions. Another systematic review, the latest that I found, says that the evidence is mixed, although generally positive. And the most important thing from this one is the last two lines. It lists the type of limitations of the studies around the benefits of yoga for cancer patients. Small sample sizes, lack of theory-based studies, weak quantitative designs. So all these things need to be addressed if we want to present yoga as part of the complementary therapies that we want to include in a comprehensive program. So, having said that, the systematic reviews do not take into account some of the most exciting recent clinical trials. I'm not cherry-picking the studies, I'm just going chronologically through the latest publications. And the one that is interesting, April this year, saying that if yoga dampens or limits fatigue and inflammation, regular practice could have substantial health benefits. And here is where I say, let's make it available to all, because if it brings benefits, then we need to bring benefits at all the population that is affected. And then it becomes even more exciting, because in May, there was a publication on the actual reduction of inflammatory signaling for breast cancer patients affected by fatigue. And there's a conclusion that is quite firm. A 12-week restorative Iyengar yoga intervention. It means that it's a traditional school of yoga, but it's restorative, so it means that it's very much focused on the breathing and on the mindfulness. Reduced inflammation-related gene expression in breast cancer survivors with persistent fatigue. And the markers that were measured were plasma inflammatory markers and cortisol in the saliva. So there are some really objective results that bring to these conclusions. And in April, again this year, a very interesting one that compared the impact on women with breast cancer undergoing radiotherapy of the benefits of yoga compared to stretching classes. And it says very clearly that yoga had a much more marked impact and long-term durability. So a lot of really encouraging studies. What are the principles behind the practice? The principles are around improving lymphatic flow, which is extremely important for everybody, but in particular for people with lymph nodes that have been removed from different parts of the body. Thoracic emptying, there is a lot of emphasis on torsions, on forward bends, on backward bends, that really stimulate the lymphatic flow from the lymphatic reservoir that we got in the thorax. And we got an impact on the stability and function of the shoulder girdle and thoracic spine. So we got a lot of invasive surgery and treatments. And yoga can really help, and the important words to use are in a gentle and progressive fashion to really address this limitation in the movement. And yoga can do a lot to address the scar tissues, and again gradually and progressively it can bring benefits that I, as a yoga teacher working with a number of cancer patients having mastectomies, lumpectomies, I can really visibly, tangibly see if the practice is regular. And a lot of the focus for classes that are specialized for cancer patients are around addressing the side effects of general treatment, chemotherapy or radiotherapy, stressing the fact that yoga is complementary, it's not instead of, it's as well as, it's alongside treatment. And there are a lot of poses, a lot of techniques for breathing that can help addressing nausea, problems with balance, circulation, digestion, insomnia. So a lot of benefits, as well as the social benefit of being part of a class that might be inside the hospital, might be outside the hospital. It's a safe space where you can really let go of the tensions in an environment that is supportive and understanding of your situation. So this is the typical information that is on one of my leaflets, and I want to use it to give a few tips to people here who might want to join a class, or who might want to run a class because they're yoga teachers, or might want to refer their patients to a class. It's a small group, you can't work with 60 people in one room. A lot of the fitness yoga studios that we have in London are really impersonal, so you need to bring it back down to the social, safe, comfortable environment. It's suitable for people who are reasonably mobile. If you want to do one-to-ones, you can work with a much broader range of patients. But people who can move independently, even if the range of movement is very, very small. And all surgical incisions need to be healed. After that, anybody can go to a specialist yoga class, and they will feel more grounded. There is this mindfulness focus. And they will use the postures to stretch, to strengthen, and to relax the body. And the strengthening without depleting energies. So there's a lot of somatic movements, a lot of very, very small sequences that really allow the muscle mass to be rebuilt gradually, slowly. It's not what a personal trainer would get you to do in the gym. It's a completely different approach. And the breathing has a massive role to play. Layers are recommended, so not dressed for yoga today, but you shouldn't have your students in the class wearing clothes that are too baggy. You want to see the people's bodies. The alignment, especially after surgery, is not the normal alignment, and you want to be able to see that, not to encourage overcorrection or overstretching, but to work with the body that you see in front of you as the person perceives it. And there is a health questionnaire, it's a must, needs to be completed. It's partly focused on the cancer history, but it needs to encompass all the other things that happen to bodies, a dodgy knee, a bad shoulder, anything needs to be taken into account, and a sort of interview and a check with the teacher before the class, it's absolutely important. So elements are pranayama, 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 loads of breathing, loads of conscious breathing, loads of extension of the out breath. And again, coming back to the stimulation of the lymphatic flow, by pushing the diaphragm down, you stimulate the lymphatic flow. By extending the out breath, making it longer than the in breath, you address anxiety issues, you reduce stress, and you help the lymphatic flow. A number of different techniques, poses. I hinted at twists, compressions, really stimulating the body very gently, and relaxation. There's a lot of research on chanting, again linked with the breathing that goes with the chanting, that can be very stimulating for the body. And to conclude, loads of benefits, starting from the physical, moving on to the mindfulness aspects, and just making people feel comfortable with their body and in charge of their own thoughts, as things around them are very hectic and very difficult. Finding a space on the mat, finding a space in a group that is supportive, that can help and contribute to healing.